enable closed captioning. Okay, good morning, everyone. We still have a couple people joining us, but the waiting room is slowing down. So I am going to go ahead and get started and people can continue joining us. My name is Maggie Dixon. I am the Home Visiting Coordination Initiative Development Coordinator at Prevent Child Abuse New York. We organize the statewide Home Visiting Coordination Initiative, which is an initiative that pulls together home visiting programs, home visiting professionals, any other folks in the early childhood space to come together and have conversations about service delivery. And we offer this monthly webinar series as an opportunity for learning and to just be in this space together. We are so pleased today to be joined by a few presenters. We have Bridget Walsh from the Schuyler Center for Analysis and Advocacy, Rachel Schwartz with Public Health Solutions, and Elizabeth Simon from Child Center New York. And we are so pleased and so grateful that they are joining us today to talk about oral health and the role home visitors and community health workers can play. Just a few housekeeping items before I turn it over to the speakers. We do encourage questions in the chat box. We don't have a Q&A function here, unfortunately, but you can go ahead and put comments, questions in the chat, and I will monitor, or one of the speakers will monitor throughout the session. Please remember to keep yourselves muted throughout the presentation. If you would like to say something, you're encouraged to raise your hand or put something in the chat box. And there are closed captioning services available. If you navigate to the bottom of your screen, there's a little bar that has a CC like subtitle option in the bottom, and I think you can just click it once and it should say show captions. Finally, we are recording today's session. It will be available to, as I said earlier, individuals who registered for the presentation. And we're currently in the process of revamping our Home Visiting Coordination Initiative website to update it. So I'm not going to make any promises about it being available on the website promptly, but it will be available at some point if you would like it. You can always send an email to me. I'm happy to put my email in the chat. So without further ado, I'm going to turn it over to our presenters, and thank you so much for being here today.
Thank you, Maggie. My name is Bridget Walsh, and I am Senior Policy Analyst at the Schuyler Center for Analysis and Advocacy in Albany. If you're not familiar with the Schuyler Center, we are a statewide nonprofit multi-issue children's organization. And our primary focus is children and families, especially those impacted by poverty. Oral health is a critical part of children's oral health, their ability to learn, to be healthy, and it's often overlooked in healthcare and policy conversations. So we try very hard to raise children's oral health. I'm going to just kick off today by setting the stage, and then I'll turn it over to the presenters for more information on really what's happening in children's oral health. So why is oral health important, and why are you so important to children, to improving children's oral health? You may already know that poor oral health is the most common chronic disease of childhood, and it's largely preventable. And so we need to remember that. And you're going to hear from Rachel and Elizabeth a little while with some details on that. And when we're talking about oral health, we're not just talking about teeth, but we're talking about gums and the structure of the mouth as well. So good oral health is a smile, but it's also being pain-free. It's being able to eat nutritious food. It's being able to talk and to learn to talk. Anything that has to do with the mouth. And so you're going to learn a little bit more today too about the connection between oral health and other diseases and conditions of overall health. So good oral health for children and adults affects not only their physical health and mental health, but their self-esteem and their confidence. So we're really looking so broadly about the impact of oral health. By age 8, most children have had one cavity in their mouth, in their primary teeth. And so we're always thinking about how do we prevent that? And children from low-income families are twice as likely to have cavities. And even though Medicaid and CHIP cover a wide range of preventive services, very few children, only a third of the children in New York State have had a preventive dental visit. And this is for age 1 to 20. I wasn't able to find the younger children, but still that's a pretty low preventive rate. And for children in New York, 14% report that they have had an oral health problem within the last year. So it's a pretty pervasive. And oral health inequities are largely influenced by community rather than individual factors. And that's something I really want to have you think about today because of your role in this. So think about your experiences working with families and some of the systemic difficulties they must overcome all the time. And so it isn't any different from oral health. Many families struggle to find or afford nutritious food, or even when they know it's important. Families struggle to find dental care or get appointments, even when they know it's important and they're trying to do that. Many families on Medicaid or CHIP don't know what their dental benefits are, and they don't know how to use those dental benefits, even when they have them. And we have many communities in this state that don't have fluoridated water, even though that's an important component in preventing oral disease. So we think about these as keys, and some families have good insurance. They have access to dentists that take that insurance. They live in neighborhoods with fluoridated water. They have healthy food. They have transportation to grocery stores and to appointments. Others don't have that, so they're missing those keys to good oral health. And without the full set of keys, families aren't able to access no matter how they try. So we want to make sure that we try to get those families the keys. And when one of the things we need to do is really rethink what is the dental system. We need an integrated approach that includes thinking more broadly about changing systems as well as addressing the individual influences of oral health so that we have the biggest impact on families. We need to think about how to meet the needs of each child and family based on their own circumstances, and we need to engage heavily in prevention. As we mentioned before, it is largely preventable if families have access to those keys, and that includes the work that you do. So the oral health systems needs to start with the work that you do every day with families. It's not just the oral health education that you do, which is really important, but it's also making sure that that you're helping families find healthy, nutritious food. It's connecting them to the primary care providers who do preventive oral health. It's using your motivational interviewing to support confidence and care in the care they do for their children. All these are pieces of oral health, and it's all the work that you do every day. So we need to put that into context and have you make sure you understand that how critical you are to really being part of the oral health system. So with that sort of context, I'm going to turn it over to Rachel.
Thank you, Bridget. That was just the perfect segue into my comments. You would think we coordinated it. Hi, everyone. Good morning. I'm happy to be with you today, and thanks for being here. My name is Rachel from Public Health Solutions, and I'm going to talk with you really about taking a two-generation oral health promotion approach in the communities you work in. So before diving in, I just want to share about Public Health Solutions briefly. We all know that health disparities among New Yorkers are large, they're persistent, and they're increasing. So Public Health Solutions exists to change the trajectory of that and to support New Yorkers and their families in achieving optimal health and building pathways to reach their potential. As the largest public health nonprofit serving New York City, we improve health outcomes and help communities thrive by providing services directly to low-income families, by supporting community-based organizations through a large contract management unit, and by bridging the gap between healthcare and community services. So you'll hear that as a theme today, as a way for us all to be successful in supporting two-generation oral health. Home visiting is really the cornerstone of our maternal child health unit. We have 7 home visiting programs, just briefly 2 NFP programs, 2 healthy family sites, the Queen's Pitch program, so that's Perinatal Infant Community Health Collaborative, federally funded Healthy Start program, and a pediatric community health worker program. And I wanted to share with you today some of the ways in which our teams are supporting 2-generation oral health. Next slide, Bridget. So at PHS, our approach really to health and wellness prioritizes both this direct support and engagement with individuals and families, but also, exactly as Bridget was saying, working at the systems level to address barriers and inequities in access to care. Most folks are familiar with this, concept of the social drivers or social determinants of health that you can see here on the right. And oral healthcare access is very much impacted by these same health-related social needs as other health outcomes. So we know that access to oral healthcare is associated with gender, with age, education, income, race, and ethnicity, insurance, and where you live. And so addressing some of these systemic barriers, addressing provider biases, and bridging community and clinical partnerships are all key approaches to this kind of holistic concept of a maternal child health system of care. And quality oral healthcare access is a very key component of that. Next slide. So I believe my mother told me, I'm not sure anyone's else, that the mouth is the gateway to the body. It certainly is true. We know that there's a direct correlation to oral health and overall health and wellness. Bridget touched a little bit on the child impact of that. And I wanted to just talk for a moment a little bit more about the 2-generation approach and what that means for pregnant folks as well. So we know that pregnant women with poor oral health can be at an elevated risk of everything that we're already working to prevent. So experiencing adverse birth outcomes, including preterm birth, low birth weight, preeclampsia, miscarriage, fetal growth restriction, and gestational diabetes. In general, for the general population, poor oral health is linked to heart disease and stroke and diabetes. We know that now, getting into kind of the 2-generation approach, that children who are born to parents with poor oral health reportedly have a greater chance of developing dental caries or cavities. And that just over half of pregnant people, so shy of 52%, report having a dental visit during pregnancy. This next data point, when I was preparing for this, was actually really enlightening to me, and I'm curious to learn more about. So this is data from PRAMS. And it showed that racial and ethnic disparities that are present in prenatal dental utilization and access are not there in preconception. And so specifically, there's no disparity from PRAMS data between Black and white families in terms of going to the dentist before, not families, but mothers before they are pregnant. Once someone is pregnant, a disparity exists. So it's just really interesting. Children with early childhood caries tend to experience more cavities than adult teeth. So there's really, a lot of us talk about this life course approach, and wanted to encourage us today to think about a life course oral health approach, because the children will become, the adults will become the mothers at some point. Women enrolled in Medicaid showed significantly lower odds of visiting the dentist for cleaning during pregnancy compared to women covered by private health insurance. So there's, again, an income disparity. And we know really the same barriers for primary care and reproductive health care, and a lot of what a lot of us are working on in communities to advance maternal child health. These same barriers exist for utilization of dental care as well. Next slide. So I want to spend a moment now talking about what we all know to be true, and that is that home visitors are special. We know that home visitors have this special kind of access to supporting families that are both culturally and linguistically aligned with the family, but also they just have greater access. And so when thinking about oral health, while traditional visits to the dentist can only provide oral health messaging twice a year, home visitors can help promote ongoing oral health messaging and resources, and that direct connection to care throughout the year and ongoing and for many years. And so really thinking about your role, whatever it is within a home visiting program, as special and important to connecting families to oral health care. And so we have this general approach to oral health promotion. Of course, at Public Health Solutions, it differs from program model to program model. And I just wanted to kind of share this. This actually comes, and I messed my slides up a little bit, so I'll show you the reference in 2 slides, but there was a wonderful piece of work done a couple of years ago in New York State that I'll touch on in a moment, but I did want to give credit to where this came from. And so I am personally a huge fan of alliteration, and so I really love this framework of thinking about this as assess, advise, arrange, and analyze. And so we talk about assessment. A lot of our programs do oral health screening. There's a pretty standard 2-set question of, have you been to see a dental provider in the past 6 months? And then, are you experiencing any pain, bleeding, or anything like that in your mouth? And so that oral health screening is kind of the first touch point to getting families connected and seeing what's going on for them. Advise is perinatal oral health messages. And so making sure that your program has 2-generation approach to doing that. So not only focusing on the child, but focusing on the child and focusing on the adults in the house as well, and making sure that they know kind of the standard for when they should be going to see the dentist, any risk factors to look out for, and things like that. Arrange, of course, is what we all do fairly well, which is making referrals for providers. And I think that's really one of the key things is linking education to action, right? And so a lot of families, and we talk about this, and I heard Bridget say this, you know, low-income families, they know things are important, but they don't have the access to be able to take that next step. And so really important for home visitors to kind of reduce those barriers in access. And then I tacked on this last one, which is analyze. It's really important to track data outcomes. And I just pulled a small snapshot to share about this. So this is actually from the Pitch program. And you can see, well, I have to make it bigger on my screen. Just 2 data points really help us do well and track what we're doing and where we need to improve. And so the percentage of clients who had a positive oral health screening and were referred, and then of those folks who were referred, the number who had completed that referral and actually received care. And this gives us quarter over quarter and year over year the opportunity to see how we're doing and share that data with providers as well and to improve. Next slide. I wanted to share just for a couple of moments around some community clinical oral health partnerships that we have throughout the state. And to kind of start that off, wanted to share this example from what was the Mitch program. You'll see this data for this first bullet is from April 2021 to March 2022. So this is statewide data that was shared at a Mitch program meeting. Now the Mitch program, as most folks know, is now the Pitch program, the Perinatal Infant Community Health Collaborative. So I just thought this was really illuminating. So of, you know, just shy of 5,000 clients enrolled across New York State during this time period, dental services were actually the #1 medical referral made by home visitors. So more than primary care, mental health, and family planning. And really interestingly, you know, just shy of 61% of those referrals were completed. And so I think, you know, when we think at the home visitor level of connecting maybe 1, 2, 5, 10 families over the course of the month or the quarter, those numbers feed up into pretty large impact. And I always like to think about the kind of the power of home visitors across the state. You know, everyone's doing their day-to-day work in their specific zip codes and communities and counties. But when you really look at that data from an eagle eye view at the state level, it's really impactful. The second partnership that I wanted to mention is something we've been doing for a couple of years in partnership with the NYU College of Nursing. ONEP is the Oral Health Nurse Education Program. And 4 of our programs are involved in the Healthy Mouse for Pregnant Moms and Their Babies research study. And really what that involved was a pre-post study assessing both staff and client 2-generation oral health behaviors before and after training. And so those were surveys for our clients, and a lot of time we focus on clients, but what I love about this study is it's also looking at home visitors as, you know, as their role as parents perhaps, and just their personal health behaviors. And so both our staff and our clients enrolled in this study completed surveys before they were intensively trained. And then the staff were able to provide kind of new health education to families. And then we'll be doing the post study soon. But I think it's really important to think about our personal thoughts and behaviors as individuals, perhaps as parents, and then how that relates to the health messaging that we provide. Another one, I think a lot of home visiting programs do this, but I wanted to share, and this has changed certainly since COVID, and we're really hoping to get back into this in a more in-person way this year, As we've done for a long time, these kind of 2-generation brief dental health assessments in our community office. And so we know there's a lot of challenge with access. There's certainly a lot of challenge with dental insurance, particularly for folks who are undocumented in that postpartum period. And so bringing oftentimes dentist students into our office was a really good approach. They would just do a kind of a chair analysis, mom and baby on the lap, and look in both family members' mouths, and then make those direct referrals from our office for follow-up appointments. So we've done that in a couple of ways, both with academic clinical sites and also with managed care. And so our pitch program in Queens works very closely with Empire Blue Cross Blue Shield, and we provide kind of ongoing oral health education and events. And we're trying to get back to this in-person 2-generation brief screening in the office. And then the last one I think is also just very important is access to tangible supplies. I know my kids always look forward to getting their free toothbrushes when we go to the dentist. And so our home visiting programs, I think, do a pretty good job of distributing not just child oral health supplies, but also parent oral health supplies. So toothbrushes, floss for parents, toothpaste and such. So really thinking about, you can see even on this slide, there's kind of different levels of approach. We're working directly with families, we're training staff, and then looking again at that data at the statewide level. Next slide, I think that's my last slide. Yeah, and this is my 3-year-old going to the dentist. This is the resource, and this will be on the last slide as well with a link. This is a really wonderful resource. One of my favorite acronyms is called POCI, and that stands for the Perinatal Infant Oral Health Quality Improvement Initiative, I believe. And so this Mitch Oral Health Manual and Toolkit was put together by some of our then Mitch, now Pitch partners in upstate in the Rochester area, along with the New York State Department of Health. And it's about a 60-page document. You'll have access to this link. Doesn't matter if you're a Mitch program or not. It has really wonderful resources. And so I would encourage everyone to take a look at it and take what works for you. With that, I'm going to turn it over to my wonderful colleague, Lisbeth Simon, who is going to speak on the Early Head Start program.
Manual and toolkit?
What's that, Cecilia?
Where can we get a copy of the manual?
The last slide here will have a hyperlink to it. It is on the New York State Department of Health website. So when you get a copy of this, you'll have the link to it.
Perfect. Thank you so much.
Of course.
All right. Good morning, everyone. Thank you, Rachel, for the invite. Well, one of the things that we do at the Child Center of New York, just to piggyback a little bit more on what Rachel has said about how do we support families. The Child Center of New York have different locations at different parts of Queens. So today I'm going to speak about the Early Head Start program. We're located at different locations. We're located at Corona, Woodside, and Astoria. Our program starts from pregnancy to 3 years old, and then the 3 to 5 for the Head Start program. So we start at the very beginning when we enroll families. We especially pregnant moms, we ask parents to give us an oral health form completed, and then from there we just build up on the assessments. So when we enroll children, when we do the intake, we do the oral health assessment. So basically what we do is we just ask parents for patterns for if they brush their teeth, if they clean their gums. We do this just to ensure that families start from the very beginning taking care of the oral health. Excuse me, give me just 1 second. I'm sorry. So we ask them parents for the oral health assessments, and then from there if we see there's any children with some concerns, we actually refer families for oral for a nurse consultant. Sometimes we see parents of breastfeeding or bottle weaning when the child is not supposed to be on the breast of, let's say, a 1-year-old or 2-year-old. I know that things have changed, but we usually refer them for a nurse consultation. We do this when we see the first, can you please go to the next slide? And okay, maybe the next one. Okay, so I was just, I'm sorry, I forgot to ask to change the slide. So the oral health during the intake process, then annually, every year we check on the annual assessment. Again, just to make sure that the child has an updated assessment on the file. We encourage checkups at 12 months or when they get their first tooth rubs. We do referrals and follow-ups. We partner up with different dentists in the areas just to make sure that the children have somewhere to go. We do parents psychoeducation on child development. If we see any concerns, we ask them for nurse consultation or oral health workshops. We also provide literature, toothbrushes, just like Rachel's program was saying. We do distribution of all supplies. We give parents finger brushes and toothpaste. We ask the home visitors to integrate in the oral health into the GGK curriculum, which is the curriculum that we follow. We also send supplies with the home visitors, just in case they don't know how to brush their children's teeth. Some parents are afraid. They think it's not necessary. They think that cleaning their gums is not necessary. We bring a lot of literature, but we give them books to educate them on. So this is what we do on the home-based services for the Head Start services. Can you go to the next slide, please? For the center-based programs, again, it's the same. Protocol. So the assessment is done also at the intake, then it gets reviewed annually. They also do the same referrals, psychoeducation. Pre-COVID, we had the NYU team come into the site and actually check on the children's teeth. Due to the limitations, well, we don't longer do it. We're definitely looking to see if that can be brought up again, but for now, we're not doing it. So based on the performance standards, can you just go back to the second slide, please? One prior. Yes, so this is the link. So within the Head Start performance standards, I don't know if I can share my screen.
Or maybe Bridget can click on the link.
Yeah, let me see if
Yeah,
I
can you
can.
click on the link?
Oops. Here we go. Let's see if this. There we go. How's that? Oh,
I think you're in the share screen mode where
I'm in the share. So hold on. Let me.
might be able to, if we can also stick the link in the chat, maybe.
Yeah.
That would be helpful.
Yeah, maybe that's.
I don't have here. I can just.
I can do that if you want to keep talking, Elizabeth. I'll get
It's
that.
the hhs.gov, right?
Right. So pretty much what the performance standards from the Head Start office is, it helps us and it helps parents it helps us see what the performance standards on the Head Start level is required from each and every program. So we basically just follow along their mandates. Oh, there you go. Thank you, Rachel. So if you have some time to look into the what the performance standards from the Head Start office tells us. And that's pretty much it. Rachel, turn it back to you.
Sure. I think so. We have just one takeaways, and really, I mean, there's so much knowledge in the proverbial room that we also want to make sure we have some time to hear what else everyone else is doing. as it relates to parent-child oral health. Bridget, can you go, I think it's 3 slides ahead.
I'm trying to see.
Oh, cool.
I don't know what you're seeing anymore. Hold on.
We see the oral health HHS.gov.
Oh, you're
slide.
seeing that one. Okay.
Yeah. Thank you for everyone's grace on a Friday morning. There we go. So just some takeaways for you, I think. A lot of, I think this message is changing over time, but in terms of pregnancy not being or being a good time for a dental visit, pregnancy is the perfect time for a dental visit. And so absolutely that should be the standard of care for home visitors, to make sure that they're recommending and really supporting a pregnant person to go for a dental visit, and then starting that child oral health education around the time that baby's born, slightly after, because of course we have a lot to go over. So another thing is to really look, and I saw some interesting comments in the chat that we'll get to in a moment about, particularly for rural areas, just really kind of structural issues around having access to dental services. But do think broadly when it comes to partnering with both academic sites, clinical providers, and payer organizations. I mentioned Empire Blue Cross Blue Shield is just one of the managed care organizations that we work with. It's really an excellent strategy to help you promote optimal life course oral health. We all know that our home visiting budgets are sometimes also tight, and many of these organizations, particularly the payer organizations, would be more than happy to provide some of those oral health tangibles. And so take advantage of that. Exactly, using finger brushes and all of those things. So I think reaching out to those partners for those. And then really think, depending on the program model, you either have this or don't, you can improve what you don't measure. And so if your program is one of those that doesn't have at least kind of one base metric on how your program is doing with screening and referring for oral health, would really encourage you to set that up. But with that, we just wanted to open this up for both questions, but also conversation at this point. This is just a highlight of some of the programs in New York City. We know there's a lot going on, and we'd love to hear from you. What's been working well? What are some of your challenges and all of that? So we'll open the floor.
I just wanted to mention, some of you might have been involved in the Early Childhood Advisory Council. We did an Early Childhood Oral Health Summit back in November. We're working on a report that'll go to the Early Childhood Advisory Council next month, and then we'll have some recommendations coming out of that. If this is a topic that interests you, I'm going to put my contact information on the slide deck when it goes out later. And if you want to get on a list for follow-up webinars, for policy conversations, for more educational sessions later this year on this topic that came out of that summit that we had, I'm happy to put you on a list, and we can keep this conversation about early childhood oral health going. So we have that as well. So yeah, I haven't had a chance yet to look at what's in the chat. So I don't know, Rachel, if you want to start, or if anyone wants to chime in or raise their hand and let us know what you're working on.
I can speak. I'm Rebecca. Hello, everyone. I'm the home-based supervisor from Mohawk Valley Community Action Agency in Utica, New York. Some of our biggest challenges, the closest pediatric dentist for us would be 1.5 hours to 2 hours away. They're even accepting younger children. We do have agency vehicles, and we try to bring our families to the appointments if we can. But that's one of the biggest challenges for us. Just, they've got the insurance, they know it's important, but just finding a dentist that will take children under the age of 3. Some even, I'm saying, under the age of 4. We've even got some around here that won't take them until they're 5.
Yeah, and that's going to be a problem for a while. I think there are a lot of workforce conversations going on now about what types of things we can be doing and who should be doing what. I think that's going to be a continuing conversation. I think that's a long-term problem. I think one of the things that I really want to focus on is the more that we can prevent early problems, and making sure that even if you don't have a pediatric dentist available, the pediatricians in your community are doing fluoride varnish. They're doing assessments. That older kids have access to sealant programs. I think that those types of things, there's now a treatment, silver diamine fluoride, that they can put on beginning cavities that can arrest cavity development. Some states are experimenting with allowing primary care providers to do silver diamine fluoride. But so there are some things that we can be doing on the preventive side. But if you can work with pediatricians in your community to be doing preventive services, all of which are covered by Medicaid and CHIP, that's something that we can be doing right now. And there's lots of programs out there to train the pediatricians on how to do fluoride varnish and risk assessments, and the same types of activities that you're doing, but doing it in the pediatrician's offices as well, with the added benefit of the fluoride varnish. And the more at risk the kids are, the more times a year they can get that fluoride varnish application on their teeth.
I also just wanted to add, back when that oral health conference was, there was a whole session on mobile vans, and I feel like that's starting to take off. And Bridget, you probably have better insight, but I wonder if anyone from that conference can kind of put together a list of like the regions that have an oral health mobile van. I think it may be a stretch, but that was definitely a big focus of that conference, is kind of taking the clinic out of the clinic and putting it out into the community. So I'd be curious to see kind of a scan of where they're available.
Yeah, there are. I don't know if there's a scan. I think we can. There are some available around the state, and there's more that are coming online now. There's several that are just coming online. I think one of the problems even the dental vans are having is workforce, right? Can you get providers to be in the dental vans? And that includes dental hygienists as well. So in some places, for some populations, that's going to be an opportunity, to provide more services, but it's not going to solve a lot of the problems in some places where you have very high need.
And I do want to quickly elevate that we did have a participant, Melissa, not to put you on the spot at all, but you did share that you have a dental van, and I'm not sure which part of the state you're from, but I am just curious to know what it looks like on the ground. Oh, there you are, your hand's raised.
Yeah, it's been a blessing, honestly. They typically come to one of our pediatric site, Jamestown Pediatrics. We're here in Western New York, closer to the PA border, but they also visit our Head Start program at Holy Family. And I'm so grateful for it, because we're having a lot of the same issues that other participants here have discussed, with getting in long waiting times, not taking new patients. We have a beautiful clinic that just got built, and unfortunately there's no dentist in there anymore, let alone pediatric dentist. But I was looking for a little bit of advice, because I can't tell you how many families we have that struggled to get their children to brush their teeth, and now they're in for surgery, having them removed. Maybe they were on the bottle too long, slept with the bottle, whatever the reason may be, that they didn't get their teeth properly brushed or cared for, and now they're having oral surgery. So I'm really just trying to nail that conversation down. And it seems like I can say it, but the follow through is lacking. So I'm just looking for tips on how to have those conversations with families to really stress that need. Thank you.
I am not a provider, I'll say that, but I've been to a lot of conferences. I don't know whether Rachel or Elizabeth, whether you use these reminder cards. They're available at Head Start. Other places have had them. They're actually refrigerator magnets that you can write on, and it's a way to help with motivational interviewing with the family. So it talks about, what are you doing? What are you working on this week or this month, with a process? And it talks about, drinking fluoridated water, reducing sugar sweetened beverages, weaning off the bottle, brushing every night before bed. And sometimes these are, because they're a reminder that you can put on the refrigerator right in their lip, and right where they they are all the time. You can write on them. So you can say, what do you want to work on this month? And, you know, to help with motivational interviewing. So I can figure out sort of where these are, but if some places have found these to be very helpful because they're a nice leave behind for families. And I happen to have a whole drawer full of conferences, but and I've
I
always
can just
liked
speak,
them.
you know, just like tips for, you know, life is busy. I think tips for anyone to remember anything, I could just speak as a mom of 3, is I've tried 2 things, and I'm saying this as, you know, home visitors can try to model this as well, is a lot of people, for better or worse, live on their phone. So setting a timer, like the parent can set a timer as a reminder, right? We're all crazy busy at night. It is not relaxed time, especially if there's multiple kids. So like using technology to help, I think, is one that's worked in my family is, because I have kids of different ages and a big spread. We all go into the bathroom together and have like a family, you know, toothbrushing session, just to make sure it's kind of normalized for them, and that we're not so busy at night that we're forgetting, or, you know, the older ones aren't doing it, stuff like that. The other thing I would say for home visitors is to kind of make a game out of it and use that parallel process. Can they model, and like, you know, especially if it's a telehealth visit, do toothbrushing during the visit is a possibility, right? And so they can, you know, the phone can come into the bathroom and the home visitor can model for the parent how to do that. And so really taking the next step, instead of just like, remember to do this every day, what's the tangible step to either schedule it on my phone so I'm told to do it, or do it during a home visit to kind of work on, you know, a lot for me with little kids is the positioning of a kid. It's really hard to brush a child's teeth if they're upright. So my 3-year-old goes back in my arm and I have more control over it. And so really some of those tangibles for me, I find brushing kids' teeth very stressful. And working on some of those things and normalizing and talking through it can maybe be helpful for the home visitors. What do other folks think?
Hi. Hello.
Go ahead, Noemi,
Yes,
we can
hi.
hear you.
Hi. I'm community health worker. Okay. Especially in Spanish. When I went to visit my clients, I recommended and remind to my clients, go to the dentist 2 times a year, and teach with your babies, with the kids, and make it with the kids, follow to every morning, maybe 2 times a day, to brush their teeth. And they pay me attention because I connected with my clients all the time. Then they say, oh, Naomi, I make my appointment to the dentist. Even when it's pregnant, I recommend that don't lose your appointment, because it's very important to participate and follow to the dentist. Thank you.
Great. I'm seeing a lot of questions and comments in the chat about resources, and we can add some to the list that we're going to send out as part of this as well. Some of the things that people have suggested, but one of the key recommendations that came out of the Early Childhood Advisory Council, the summit conversation, was just that. How do we get resources? Where can we go? Can there be one place we can all go and just see what's out there? There's a lot of libraries of resources that are available, and you'll see some of those in the slides when you get them. But also we're hoping to develop sort of a one-page place where all of you can go and just click on and see what's available out there. There's a lot available, and there's a lot in multiple languages. There's training programs. There's ways to get materials that are all free, handouts for families, trainings for your staff. We just want to consolidate those into one place to make it easier for you to find them.
There's one question in the chat, or a comment really, from Michelle Selman Fisher that is interesting. I'd love to hear from other folks. So she said, many times parents, caregivers of children experience stigma and embarrassment for their children's oral health. What recommendations do you offer to staff who are providing support to them to not further create harm and assist in them doing return visits? And that's certainly true. So I don't know if, Michelle, you have anything further to say, but just to hear from other folks as well. I think some of the home visiting models do this very well. in terms of some of kind of the reflective factors and how you can ask and wonder. And so, of course, withhold judgment, but a lot of it does come down to the provider as well. And so I think giving families some of those tools to be responsive to that is important, but would love to hear from folks or Michelle, who phrased the question, what you think about that.
I'll speak for our agency for home-based visitors and for our classrooms. We have a couple of things. We have a cavity-free kids curriculum that we use in our classrooms. And I think for dental health for home visitors, I always want to make sure the home visitors know it's ongoing. It's not just bring it out because February is dental health month, or it's ongoing all the time. So build it into those weekly home visits, and start where the parent's comfortable, and then work your way up from there. If you bring in an activity that has to do with toothbrushing, it's focused on the child and the parent together. And if it just becomes part of slowly becomes part of their daily and everyday routine, I think the parent just starts to become a little more comfortable with it. We've actually made bedtime routines where we've put toothbrushing into that. So kind of just focusing it in the whole area altogether rather than, just once a year or once, twice a year when you're supposed to be taking your child and yourself to the dentist. And we also partnered with a couple of local dentists in the area, and they come right into our classrooms, into our schools. The parents sign a permission, and we have a separate room in each building, and then they get a dental checkup right there at school.
Anyone else? And also feel free to speak from personal experience.
Martika?
Hi, yes. So I'm a TSS caseworker out for Access Supports for Living out in Newburgh. So I do help with kids in the foster care system, and it's just like an independent living skill that we basically teach them with brushing your teeth, among like going to other providers, like their yearly checkup, and if they're a female, to make sure that they go to their GYN and whatnot. But as a personal experience, I do have like almost a 3-year-old. And what's helped me at that age, most kids like to help their parents. So I always suggested, hey, do you want to help mommy brush her teeth and I brush your teeth? And I've always found that to be helpful because they like to help. And so I'm able to brush her teeth how I want to, and then she'll be able to brush it afterwards. And then once she's done with me, of course, I go brush mine because I know she's not really doing a great job, but she's trying. So I just found that helpful.
Awesome. Thank you for sharing that. Okay, I see from Cecilia, you're just asking where can we access finger brushes and toothbrushes? Our programs have ordered them on our budgets, our program supplies budgets when we have them, and then certainly looking for donations. So as I mentioned, some of the academic training programs in New York City, NYU is one that you'll hear often. So they had that approach before the pandemic and are getting back out now, where their dental students will go out and do those chair 2-generation screenings, and they would always bring kind of the dental swag, we'll call it, but also managed care. So health insurance providers reaching out and seeing if they can do a donation would be a good strategy.
You might also look at your community colleges and see if there's a dental hygiene program. And maybe there's an opportunity for dental hygiene students as well to come and do screenings. They can apply fluoride varnish. So there's perhaps or at least they can talk to parents and do some more education. So check your community colleges for dental assisting programs or dental hygiene programs and see if there's a partnership there as well.
Okay.
So there's a company called Noodle Soup. What does they provide?
They have like health education, a lot of breastfeeding
education,
support,
okay.
like the My Plate stuff. So yeah, you can certainly order kind of promotional ones if you want to put your logo on there from Noodle Soup. Okay.
What is that, noodlesoup.com?
Something like that. Yeah, you'll put like Noodle Soup Health Education, or else you'll get Lipton probably. But you'll see they have a great catalog. You can order all sorts of stuff. Definitely good stuff for World Breastfeeding Week. We often order things from there.
Awesome. Thank you so much.
Great. Well, we will continue to add resources to this list so that when you get it, when it is mailed out, there'll be some links for you to check out resources. And if you're interested in staying in touch and maybe doing some more work or educational around this, feel free to reach out to me. Drop my email in the chat and you can get on some lists, or I'll put it in the slides as well. I think our last slide was just resources. So since those are links and you've seen most of them already, there is also, I'll just mention the Smiles for Life program. If you're not familiar with it, it is a training program with different modules, and it's geared for a wide variety of practitioners about the importance of oral health and educational tips and things that you can be doing, the importance of oral health, the clinical aspects of oral health, and you know, when you get the resources, you can click on that. There may be some training programs within Smiles for Life, and it's all free. It's all free. That might be helpful for your program as well.
And I just see that Euphemia from our Healthy Families Corona program, thank you, shared. A lot of programs use GGK, Growing Great Kids, and they do have an oral health component that is really wonderful. And so whatever curriculum you use in your programs, definitely seeing if they have a specific oral health one that you can walk through. And I think my parting two notes is also really look at the data. So it's, you know, if it's even just like the number of screenings and referrals you made, I think that's something where you can take that information to providers and say, you know, we have a willing population that is seeking out support, but we need your help. And so really using the data to help with those partnerships could be a good strategy. Thanks.
Great. Maggie, is there anything else that we need to do to close?
No, I was just going to say, it looks like we can give everybody a couple minutes back in their day. Thank you very much, Bridget, Rachel, and Lisbeth. This has been a very informative session. Thank you for sharing your knowledge and these resources and tips. And thank you to everybody else who has attended and participated in the conversation and been active in the chat. This has been a great opportunity to just learn from each other and share ideas and resources. Just very quickly, although the federal funding for the HVCI has come to a close, so we no longer have a very long data collection feedback survey, we will be sending around a little survey, probably a Google form in the email, just to gather some feedback and ideas and input from all of you. So be on the lookout for that. And in that email, we will also make sure to include the hyperlinks that were referenced today and some follow-up information. So as long as you're registered for today's session, you will be on that list and you'll receive that follow-up email. If anybody has any questions, please feel free to reach out to me. And I know Bridget put her contact information in, but the speaker's contact information will be in that slide show we share around. And I know that you're probably more than welcome to reach out and continue the conversation. Thank you very, very much for everybody taking the time on this Friday morning. And we hope you have a great day. Thank you. Thank you.
Thank you.
Bye.
Thank you. You as well.
Thank you so much.
Thank you so much. Have a great day.
You too. Bye. Thank you.